name is John Jennings. I'm a registered nurse and a public health nurse, licensed in the state of California. I work for the Department of Veterans Affairs as a telephone advice nurse, better known as a TAN. What I'm trying today is to solve the problem of our asynchronous schedules in relationship to in-services and journal club presentations. Most of us, we are required to do these things, but we make these presentations, we prepare them, and then nobody shows up because, the staffing is low that day, or people are busy and can't leave their desks. So what I'm doing is to try to solve that problem. I'm making a recording and uploading it on YouTube so that people can go to YouTube on their computers at home or at work, because this is part of our work obligation, and begin to watch. And if a call comes in, you can pause it and minimize it and get back to it later. And that way, all of us will be able to attend this presentation if you feel like it. So what I'm presenting today first is Journal Club presentation of an article, and I have a follow-up presentation which is an in-service on meditation, and it sort of answers some of the concerns of this paper. This is a paper that you all have a copy of, and if you didn't read it, it's no big deal, because I'm going to explain what I see in this article. So all you have to really do is listen and follow along, and hopefully you'll get something out of this. So we have our Journal Club outline. That I put in your package. And then we've got the research article. Now, the research article is an article that is done by a group of Scottish nurses looking at telephone advice nurses in the Scottish healthcare system. There's 1, 2, 3, 4, 5, 6 nurses. One of them is a man. Yay! And so what they're looking at is stress amongst nurses working in a healthcare telephone advice service, relationship with job satisfaction, intention to leave, sickness absence, and performance. So is there job stress in the TAN? Of course there is. Look at me. Look at this face from that stress. And does it have any relationship with job satisfaction, intention to leave the job, sickness, sick calls, and overall performance? Okay, so we'll just follow along with this outline here, and I'll explain what's in this article, hopefully. Okay, so the outline begins really with the evaluation of the problem, literature review, and what is the question that they're asking. Okay. First, they found no studies that studied the stress of TANs in detail. And this study just came out in May of 2012, so it's brand new. I believe it was done between March of 2008 to March of 2009. So first, the statement that stress in TANs has not been evaluated in detail. Then the literature review. They say that nurse stress has been studied, and the results of those studies, which they quote in their literature review, is that nursing is a highly demanding job. Nurses have poor support. Things are rapidly changing. And another stressor in nursing is death and dying. So these are the concerns: highly demanding work, poor support, rapid change, as we know, and death and dying, and dealing with death and dying as nurses, because we're at the bedside as people are dying. Now, the further literature review found that many healthcare delivery systems globally are using TANs as part of their system. Another literature review piece of research found that TAN work is very similar to commercial call centers in that there's job monotony, there's lack of time between calls, and this really is addressing centers where the calls come in and are routed to the person talking on the phone. So we're talking about commercial call centers that call you, at 7 o'clock in the morning when you're still asleep. Lack of time between calls. They're talking about this software that just routes the call to the person on the line. So as soon as you hang up, you have another call coming in. So that's job monotony, lack of time between calls in call centers, difficult callers. We all know what that's like, and high levels of stress. So that they found in call centers. The shift difference is a factor in nurse stress in another paper, and they cited evenings and nights as the big stress times in nursing. And then another study found that high stress in nurses has a significant meaning for nurse and patient relationship. In other words, high stress results in poor nursing, it results in illness, it results in reduced job satisfaction, decreased patient satisfaction, poor care, higher mortality when nurses are stressed, more accidents, increased errors, increased absenteeism, increased attrition, and the increased attrition results in inadequate staffing. So that's the literature review of what has been found about nurse stress. And so now TAN stress has not, that's traditional bedside nursing that they're talking about there. TAN stress has not been studied yet. So this group of 6 proposes 2 questions. Is reported stress high in comparison with the general population? And is it related, if there is stress, does it cause reduced job satisfaction, increased intention to leave the job, Does it cause increased absenteeism? And does it affect work performance? Okay. So those are the two questions. Is there high stress? And if so, does it affect job satisfaction, intentional leave, absenteeism, and work performance? Okay. So then that covers the evaluation of the problem, the literature review, and then their questions that they want to study. Next is the evaluation of the methodology. So now we get into those big words, bringing back my PTSD from nursing school. Okay, so the design of the study was telephone advice nurses in Scotland for the National Health Service. And as I said, the study was actually carried out between March of 2008 and March of 2009. And what they studied was they wanted to look at the psychological, behavioral, and cognitive measures, excuse me. And then to deduct from that answers to their questions. So psychological, behavioral, and cognitive. The sample, there are 465 TANs in the Scottish National Healthcare System. Scotland is a small place, and they have 465 TANs. It's quite a bit. So what they ended up with, they invited all 465 to participate. They got responses from 159. So their N equals 450, 159. They excluded people on beta blockers because beta blockers have a calming effect on the heart rate and consequently on our brains. If your heart is speeding, you're going to be a little more anxious. If your heart is controlled by a beta blocker, you may be pretty calm in a stressful situation. So they excluded anybody on beta blockers, and that was their sample. So if you go to the outline, the design we covered. TANs in the National Healthcare System in Scotland. The sample, 159. The procedure was that they filled out various questionnaires, and the researchers, the TANs filled out questionnaires. The researchers had access also with permission from the participants to the employee's time and leave statement and to evaluations to cover the part of the study where whether performance was compromised because of stress. So they had evaluations and time and leave statement and questionnaires. Okay, so the questionnaires that we used, which is here the instrument, D. We're on number 2, part D, the instrument. So the questionnaires used were established questionnaires that are accepted among nurses and healthcare workers for research purposes. And they were selected for their acceptability, reliability, and validity. Research, big words. So that covers that. Now, the questions. What were the questions and the themes? The questions and the themes. Is stress in TANs high in comparison to the general population, or as they word it, published norms? So what they found that stress was stress was lower in TANs than nurses who had direct patient contact, bedside nurses. So we are less stressed out than our colleagues upstairs. Um, but that the stress that we did have stress that was higher than the general population. Okay, so stress exists, not as bad as our fellow nurses, but it's higher than the general population. Now, job satisfaction. Did stress play a part in job satisfaction? So, the stress, what they found was the stress being experienced by TANs had an effect on family life, a significant effect on family life, causing conflict, which impacted job satisfaction, and it also it indicated that it was a reason in Tan's intention to leave the job, so that there is an effect on family life and on intention to leave the job. They didn't find any hard evidence of it affecting sickness or absenteeism, but I'm not sure I agree with that, and I'm not sure that they found the evidence that they should have found. Although they say that there wasn't, and maybe Scottish nurses don't call in sick when they can't take it anymore. But I have my doubts about that. Anyway, that's just my opinion, and it does have an effect. The stress has an effect on work performance in that they found that nurses who used software for triaging had less stress. The software was a stress reducer. So, this study was very, very clear. It's amazing. The literature review was very comprehensive. The questions are very, very clear. It's do you know is there stress? Yes, there's stress. It's less than floor nurses, more than the general population. Does it cause family conflict? Yes. And does it affect intention to leave? Yes, it does. Um, does it affect sickness and absence? Is that a reason for absence? No. And what they found was software, according to work performance, looking at work performance versus stress, software helped to reduce stress. So it's just very, very clear, this study and its results. They even have these wonderful little boxes here that just goes down right down. What is, and this answers some of our questions here. Stress is common among nurses. Stress is associated with important consequences for nurses' well-being um, and for patient care. That's what is already known. Many nurses now work in non-traditional environments as stands. What does this paper add? So she's summing up in this little box here on page 1632 what the group is summing up. That we know that nurses are stressed. It has important consequences for patient care, and many nurses work as stands now. And what the paper adds, overall level stress among nurses working in telephone health advice line were comparable to those found in the general population, unlike levels of stress found in other studies of nurses. Work-family conflict was significant predictor of job satisfaction and intention to leave employment, and was somewhat related to sickness absence among nurses working in a telephone advice line, implications for practice and or policy, strategies to minimize the time and strain-based impact of nurses' work on their home lives um, might be helpful in improving job satisfaction, and stress management programs would be helpful also. So, to get back to our outline, the results we discussed. What are the conclusions? We discussed that. And what are the implications for practice and research? Do the implications go beyond the findings? What is Give me a second to think here. Do the implications go beyond the findings? Well, I think they do, in the fact that there would have to be further study of interventions to address the problems here. What is the next research step? Well, that's just it. Implementing a stress reduction program and seeing what that would do for TANs. Based on the study, what would you do to change practice? I think probably the only way that we're going to address that is through dealing with ourselves and stress reduction. I don't think at this point that we can change job function. So it would come from our own personal stress management program, or one that the VA would set up. And that's how we would change practice, by reducing stress, and that way raising the quality or the quality of the nurse-patient relationship on the phone, where if the nurse is calmer and less stressed out, patient's going to feel more comfortable, feel cared for. Even in the voice, when you think about, I can think about personally, if I'm stressed, I know my voice is different. It's a little more pressured, rather than trying to modulate my voice to achieve a trust and a bond between myself and the patient, and getting the patient to trust that I know what I'm talking about, and then to take my advice, rather than pushing and pushing and pushing and pushing. And on to the next one. And so if I'm not stressed, I think um, it's better for the patient. So again, the change would be in the nurse rather than in the details of the job at this point, is what I say. Uh, anyway, I'm going to sum up now, and this is so we've gone like 25 minutes in this presentation. I think it's an excellent study. It's so clear. It really does. It makes me want to write these guys and say how much I enjoyed it, even though I had to pay $35 off the internet to get it. But um, good study, and our follow up on this will be our informal discussion around the office, like we do when we have a moment on various topics, and this can be one of them so that we can share our opinions with one another. And I hope you enjoyed this. I hope it wasn't too boring. And I hope this works for changing the way we present in services and research papers in our journal club so that we all can participate asynchronously and learn something from one another. I hated missing um, the journal presentations that others have presented um, because I'm off, and I'm sure other people have expressed the same thing. So I'm going to do an in-service. I'm sorry, I'm looking at the time. I'm going to be doing an in-service on meditation, also as an adjunct to this, to deal with stress. So if you have the time, listen to that also. Hopefully, it'll be interesting and valuable to you. So, thank you for listening, and that's the end.